It is the second most common cancer in U.S. women. According to the American Cancer Society, breast cancer is expected to kill more than 42,000 women this year.
One recent study shows many were avoiding screenings during the early weeks of the pandemic.
Now, during Breast Cancer Awareness Month, doctors are urging women to get checked. Morning anchor and health reporter Kirsten O'Connor is standing by now to Ask a Doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, I recently chatted with Dr. Tejal Patel, the director of breast imaging at Osceola Regional Medical Center. She says now that offices are back open, it's very important that women start back on their screening mammogram schedule because the annual screening is not something you want to skip. When you don't have high risk factors, she recommends women start getting those annual mammograms at the age of 40.
1 year can make such a difference. So if you skip and you say, oh, my last year, my mammogram was okay. No, it's very important. And I know right now with the circumstances that we're living under, people are scared, but this is also a very important exam because a mammogram will be able to detect a very small thing, which you're not going to be able to feel. And so it's an essential exam to get. Now, this lady, luckily, came in last year, had nothing. Came in the following year, and you can see this big mass in the right breast. Now, mind you, when we asked her, we do a screening, do you feel anything, any pain, everything? Everything was normal. There was no pain. There was no, any kind of lump, nothing. But she had a pretty big cancer in her. And we brought her back in, got her biopsied. She's already had treatment within a month, and she's got a good survival rate.
So as you can see from that example right there, early detection can save lives. And that's why screenings like mammograms are so important. Another question that Dr. Patel answered, how fast can one of these types of tumors grow?
I have seen where a patient once came to me, I believe it was the month of February. We did her screening mammogram, nothing, clean breasts. And she felt a lump within 6 weeks.
Wow.
And she came back, she went to her doctor. Doctor said, okay, you need to go back, get more images, get an ultrasound. And I think it was the end of March. And she came in and we were like, oh my God, and that was a big mass. So it developed within 6 weeks and it was palpable too. You could feel it. I have seen where a patient once came to me, I believe it was the month of February. We did her screening mammogram, nothing, clean breasts. And she felt a lump within 6 weeks.
Wow.
And she came back, she went to her doctor. Doctor said, okay, you need to go back, get more images, get an ultrasound. And I think it was the end of March. And she came in and we were like, oh my God, and that was a big mass. So it developed within 6 weeks and it was palpable too. You could feel it. If something is 5 millimeters, you may not see it right away, but so it can happen. I have seen it 1 month, complete clean breasts, the next month. Now, in those kind of cases, you are going to feel a symptom.
Now, she did say that some of those palpable lumps that you can feel sometimes, depending on the woman, are not signs of breast cancer. So that's really important to know your body and be able to talk to your doctor about that. Dr. Patel recommends genetic testing on a case-by-case basis, especially for younger patients.
Unfortunately, I'm seeing cases where the patients are younger and younger. I see quite a few in their 30s, 20s, even 40s. People think, oh, it doesn't really happen until after 50. And yes, majority of breast cancers, they occur, after 50. But there are still quite a few that are occurring in their 30s and 40s. And some 20s. And those 20-year-olds are usually, they're going to have some strong family history or there's a genetic marker or something associated with it. But the 30 and 40-year-olds, a lot of them, no pertinent history, no genetic markers, nothing.
And a lot of that genetic testing can be done using a genetic counselor. We have a cancer center right here in Orlando where you can connect with a genetic counselor and talk about risks and the benefits of doing that genetic testing. Now, Dr. Patel recognized the fear that some patients still have about mammograms, but she says that technology has advanced so much in recent years. It's really not a painful process, and the amount of radiation from a mammogram is so low, she says you can get more radiation from being on an airplane than going and getting your annual mammogram screening. So keep in mind, these screenings are life-saving. They're something that you can schedule today. I know I've done many stories about get a mammogram, give a mammogram, about women going together to go get lunch one day and scheduling their mammograms on the same afternoon so that it's not so scary. Have somebody with you. Do whatever you have to do, but just remember that this is not the year to skip your mammogram. I'll send it back to you, ladies.
Yes, and you know it's great to have your buddy too, so you can remind each other to do your self exams, have that
Sure.
buddy check every month.
That's
Thank
right.
you, Kirsten.